All right, let's take a look at the posterior leg, lower leg region, and you'll see that it's dominated by the gastrocnemius. You have two heads, one that's a lateral and one's a medial head. Now again, you don't need to know the different heads, but just understand that when you see somebody with the big calves, that right, it has one medial facing head and a lateral facing head, and it's superficial. Then if you take a look real close, you see number 25 right here. This is the plantaris muscle that is found between the two heads of the gastrocnemius. As we look at the gastrocnemius as well, right, underneath the gastrocnemius, you'll see the soleus muscle. The soleus muscle is very similar to the brachialis in that it is deep to the overlying gastrocnemius muscle, which is superficial. As we go more laterally, we're going to see the Fibularis longus, number 22, right, otherwise known as a Peroneus longus. A little bit lower, you see the Fibularis brevis right here. And you can see its insertion point on the lateral aspect of your feet. As we look at the front, right? So when you can look at the front right here, I'm just going to skip to the medial aspect right here. So this is your tibia, right? And when you move your foot upwards in a dorsiflexion fashion, you will see that the movement is activated by the muscle very close to that tibia or your shin. This muscle is called the anterior tibialis muscle. Next to that, right, you're going to see laterally this muscle right here, and this is your extensor digitorum longus muscle. Again, if you see an extensor digitorum longus, you will also see deep in the foot area, number 31, right, the extensor digitorum brevis. Now, as we look back here again, I'm going to remove the gastrocnemius, and now we can see the deeper muscles of the lower leg. So the first one you can see is deep to the popliteal artery, is deep to the tibial nerve. This is called the popliteus muscle. Right? The popliteus muscle kind of encircles from the lateral epicondyle of the femur all the way to the medial aspect of your knee. Right? As we look down a little bit, right, you're going to see a number 27, right? And this is your flexor digitorum longus. Then if you take a look up here a little bit, right here, you see number 28. Number 28 is from between the fibula and the tibia. This is your tibialis posterior muscle. As you move downward from that, you see number 29 coming down, and it's going to actually go all the way underneath this tendon and go into your small, or into your hallux or big toe. This is called your flexor hallucis longus, number 29. Right? This nerve that we see up here, this is the end nerve that comes from your sciatic. This is your tibial nerve. The nerve that we see kind of moving around the lateral aspect of the knee is your common fibular nerve. I'm going to remove the gluteus maximus and remove the hamstring muscles up here. And now we're going to see your sciatic nerve coming down. It splits to the common fibular, which is number 65, and it splits into the tibial nerve on its way downwards. The common fibular encircles, and then it's going to turn into the superficial fibular, 67, and once we remove this one, you can see the deep fibular, number 66. Again, fibular and peroneal are always used interchangeably.